Hello everybody, and welcome to my presentation for my senior practicum project. For my presentation, it was conducted on peripheral vascular catheters, and specifically it was conducted to see how dressing changes can be used to decrease infection. So through the project, we're going to go ahead and look at, of course, the introduction, the project overview, the learning strategies and project design, the outcomes and results, the impact made to the nursing practice, areas for future consideration on how to improve the hospital policy, and then, of course, the conclusion. So this project took place in a hospital in Virginia, and it was actually on a COVID unit. The reason it was on a COVID unit was just happened to be where I was working at the time, and the unique thing about this unit was the dynamic of the staffing. So rather than having a specific set of staff who worked this unit, there was actually a rotating staff. And not only that, the patient population tend to stay for at least 7 days, which would have been a requirement in order to assess if a patient needed a dressing change. So this project was designed to evaluate those peripheral catheters and see if the dressing changes were being completed, because as we all know, when a dressing is soiled, damp, or loosened from the skin, it is more likely to be susceptible to infection. So the idea was to reduce infection by increasing awareness of the hospital policy. So total, the education was given to 18 staff members, and this education consisted of a brochure pamphlet style education with a follow-up web-based quiz. When the quiz was given out, the average score for the 18 participants was 92%, which is fantastic. And following this quiz and education, a 2-week chart audit documentation began. Now, specifically, 20 patients were on the unit who had been there admitted for at least 20 days, so these patients were used. Overall, there was actually a very positive correlation between the two individuals who had had the opportunity to both have the education and have a dressing change occur, whether that was an overdue dressing change or due dressing change. They did complete it. Compared to the other individuals who had been part of the patient IV documentation, overall, most of the other individuals who did not complete an IV dressing change were not a part of the education, therefore showing that they were more than likely to have non-compliance due to misunderstanding of the hospital policy. So in order to begin this project, there was specific learning strategies set in place. There was actually 3. One was the design phase. Now, this specifically looked at how evidence-based sources and current review of the hospital literature would sculpt an educational pamphlet into being able to be handed out to the staff members with that follow-up quiz. So all of these items were gathered, including recommendations for how the policy could be strengthened. That led me into the implementation phase, which consisted of handing out educational brochures, tracking those quiz results, and then compiling a 2-week chart audit on those patients on the COVID unit. Then we went into the evaluation phase, where we really analyzed the data and truly what made the nurses who did not complete those dressing changes, what made them non-compliant with the policy. And then, in addition, also did we see a positive correlation with those who did complete the education and did complete dressing changes. So overall, the outcomes and results for the amount of time that we've had for the data collection were very positive. So as I stated before, 18 staff nurses were participants in this project. And of the 2 individuals who took the education, they had also been able to have a dressing change and completed it. 35% of the patients that were in this 20 patients admitted for at least 7 days had overdue dressing changes, and every nurse that had an opportunity, so once a shift every 12 hours, to complete these dressing changes did not do so, mainly because of misunderstanding of policy. So The policy states for the hospital that a dressing change should be changed every 7 days routinely or as needed if soiled, damp, or loosened. For routine dressing changes, which we are primarily looking at, we did not see these nurses changing the dressing because they were stating in IV documentation that the dressing changes were to be due 2 weeks after placement, which would be completely incorrect given that it is 7 days. So quite a few nurses documented this, which proved the importance of hospital-wide education on this policy. Overall, this allowed me to come up with more effective ways to implement and provide better patient care due to the gaps that were in the education that's currently being provided by the hospital and maybe the perception of the policy. Some of these areas of consideration and improvement, as kind of stated before, one, longer data collection. 2 weeks was not long enough to see how the impact of that education was truly made on the nursing practice. Longer times, a couple of months would have been at least better, giving all of those nurses a more broader opportunity to create those dressing changes. Of course, with the limitations of a COVID unit, we are also limited to being able to go in and visually assess the characteristics of these dressings. For that reason, that is another limitation, perhaps conducting this project on a unit that had a ability to not be, locked down because of airborne precautions would definitely be something to consider. In addition, increased staff education. As we saw with that positive correlation of those two individuals who received the education and completed the quiz, with this, all those other staff nurses could have had more opportunities to complete those dressing changes had they realized that they should have been done a week ago, not 2 weeks. This leads into, some training seminars on how IVs work, types of dressings, and how to document the IVs. Dressing changes may be going unnoticed and underassessed due to lack of knowledge, especially within newer nurse populations. Lastly, one of the gaps seen in this project was mandatory education on the IV policy. Not only did we not see, education being sent out to all staff members, we also did not see documentation being mandatory as with other assessment data. If this were provided on a checklist under each patient's EMR, we might see an increase in compliance with assessing these dressings, especially catheters that are being left idle. Overall, this project was fantastic at making a very large impact to the nursing practice at the hospital in which it was conducted. First way is to improve patient care by allowing us to understand why certain things are not being completed. We're able to fill in the gaps. This will also improve data collection. If we know that we need longer time to complete data, then we're able to really fully focus on that rather than on a 2-week time frame. In addition, encouraging those policy changes. If we see that there is a policy gap between the perception and the reality, we're able to bring those up front, in addition to closing those gaps on lack of staff education. If more nurses understood the policy, there would likely be more compliance with the policy. Overall, this project demonstrated the importance of adequate data collection. As stated before, 2 weeks was just not enough time, but in nursing practice, we have to have a longer data collection in order to fully get a broader picture. This identified ways to improve the current hospital policy. Not only do we need to improve the documentation, we also need to improve the education as well as other ways to prevent patients from having to constantly have catheters placed unnecessarily that are being left idle. And the last couple of ways would be improve patient care delivery by decreasing those gaps in care and allowing those IVs to be more frequently assessed with dressings changes so we can prevent infections such as phlebitis, as well as increasing that staff education so that there are less gaps in the knowledge of what to do with the policy and more patient care being delivered. Thank you so much.